Good morning. I'm Dr. Kahoot. I understand you're here to see me about your ears today. All right. What's the problem?
Basically, they just feel really predominant and like they think that when I have them, that just makes me happy.
So you're trying to, they're making you feel a bit self-conscious, is that right? Yeah. All right. And this, I understand it's been something that's been with you for most of your life.
Yeah, like all through high school.
Yeah.
Just never done anything about it.
Yeah, that's the common sort of thing. Now, let's have a good look at your ears. So what I'll do is I'll examine your ears first, see exactly where the prominence is, because any part of the ear can be prominent or out of position, out of balance, or out of proportion. So we'll have a good look at your ears, determine where the problem is, have a look at the symmetry between the left and right ear, all right, and then, perhaps take some photographs, and then move on to actually discussing what the surgery or what the correction entails. All right, so let's have a good look at you. Now, when I look at your ears from the front, you've actually got good size ears, good shape ears. I might actually ask you to take your earrings out for this. Thank you. Now, the size of your ears is right. The symmetry is not bad either, actually, and I can just see that the top part of the ear is just sticking out a little bit too much, but the earlobe is very good, and in fact the fold, which is often the problem and not formed properly, is also very good. So it turns out that when we look at actually doing the correction of your ears is actually going to be relatively straightforward. It is going to involve an incision behind the ear, all right, so there's no cuts or scars on the front of the ear at all, so they're not going to be visible. The incision is completely hidden from view, all right. Once the incision is made, all we then do is reform the fold on the ear, so it's going to be this part of the ear, all right, it's going to be just furled up slightly to push the rim of the ear back. All right, and then the whole ear, so the whole inner ear, is going to turn back slightly. All right, so we are physically pinning the ear back. Now, it's important that when we're doing that it's not overdone. Over-corrected ears or ears that are right up, flat up against your head just don't look natural. They don't look right. So we can't overdo it. We're just going to look for a, good, natural-looking correction. All right. Now, this operation is done usually under general anesthetic, although we can do it just under sedation also. All right. It takes about an hour, hour and a half to perform. And generally once you wake up from the anesthetic, a couple of hours later, you're right to go home again. All right. You will end up with a bandage on your ears over your head. All right. And the bandage has got to be in place for about 24 hours. It can't. Well, after the 24 hours, the bandage comes off, all right, and it's usually just replaced with a headband when you go to bed. All right, we don't want the ears to sort of flip forward, when you're not aware of it and undo or break the stitches. So we've got to guard against that. But other than that, that's pretty much what's involved in the aftercare. The stitch that's behind your ear will have to come out about 7, 8, 9 days after the operation, but once it's out, then we just leave the incision to heal by itself. Okay. Now, in terms of getting you back to normal activity, generally you're right to go back to your normal office type work, within a few days once the bandage is off. So I would expect 2 or 3 days back to work, but you have to be careful not to do any strenuous or vigorous physical activity. All right, so that means no gym for about 4 weeks. All right, no contact sports for about 2 or 3 months. All right, because again, we've got to guard against you accidentally being pulled or pushed or bumped against the ear, which could cause a problem. It could cause the stitches to come out, all right, or break, or the incision to come apart, which obviously we don't want.
Yeah.
So those would be your restrictions, but generally you can see the result pretty much straight away. So a couple of days and You look in the mirror and they'll be the new you.